Hello and welcome to your daily dose of complete health with your local chiropractor, Dr. Patrick Hogg. Please like and subscribe for more videos.
Good morning, this is your daily dose of complete health with your local chiropractor, Patrick Hogg. And I just wanted to go through what are the changes we would expect to see in someone with chronic stress, and how do we actually go about then correcting something like that? What kinds of things can we actually start to see change, etc., etc. Now, stress is something that all of us will go through at some point in our life. It's a constant. But what happens is our brain goes into something called sympathetic dominance when we go through chronic states of stress. And what do I mean by this? Well, if we're constantly getting hammered at work, or being overloaded by work, or we're just feeling constantly overwhelmed, our brain, you'll notice, will start to create physiological changes within our body. Now, most people have heard of fight or flight. Now, this is essentially the sympathetic response that our body produces when we're under stress, which is a completely normal survival instinct, and we would never have made it as far as we would have done had that process not been able to take place. However, when we get stuck in that situation, it can start to have chronic effects on our health. Now, let me just ask you the question: if someone starts shouting at you, what starts to happen to your heart rate and your breathing rate? And we both know that realistically, if someone starts shouting at us, our heart rate will start to increase. Now, the thing is that if that is constantly going on and you're under chronic stress and your heart rate is constantly elevated, what happens to stuff like your blood pressure? And as a result, what then starts happening to other organs and functions within the body? What starts happening to our memory when we're under chronic stress? And typically it will go down. What will start happening to our clotting factors, our pain sensors? Again, these all start to change. And so as a result of having chronic stress, we start to have chronic effects on our health and our body's ability to recover. Now, the reason we know that this takes place is actually we've taken stuff like PTSD patients and stuck them into brain scanners. So we take stuff like radioactive oxygen and do MRI scans, and again, we'll be able to pick up what parts of the brain are starting to become active in PTSD patients when you almost use certain language or certain sounds or certain things to, thanks Mark, certain things to, this is work by the way, certain things that will start to trigger certain parts of the brain, so we can start to see the oxygen levels going up in the area, and we can detect the radiation from the oxygen that we attach to that. So we can actually start to see what chronic stress does using MRI scanners. And what we've started to see is people under chronic stress, their brains will adapt and they'll push this sympathetic dominance attack. Now, this can start to lead to, as far as my patients are concerned, constant muscle aching or tightness in muscles, changes in range of motion. Why? Well, what we know is that the muscles in the body start to respond to the sympathetic dominance by actually becoming tighter and stiffer and getting ready to attack or run away, which is exactly what would happen if we were in a survival situation where a lion or tiger would start to chase us. So just note, there are certainly things that you can do, there are physical things we can do, stuff like exercise, we can go for stuff like a run, or even things like meditation that can start to calm our brain back down again, eating properly so that we can start to improve the neuro system within our stomach that will all start to actually have calming effects, but also stuff like avoiding stress and finding environments that actually make us happier start to help us balance out these systems. But maybe you need a little bit more help in aiding some of the outcomes or effects that stress is starting to have on your body. And then maybe this is the place for you, because we're going to look at things as a holistic picture, because we always have chiropractors, physios, massage therapists, but we also have occupational therapists and psychotherapists that work on site within our practice as well. Patrick here from Complete Health. This is your daily dose, and we'll speak to you again very, very soon. Take care for now.